into it and over it, and you'll take it off and the wound will be the most disgusting thing you've ever seen, or you'll put the cast on and it'll compress them so much that the cast is rocking around, and they're walking around in a cast that's hitting off the front of their tibia.
Do you take it off no matter what, like after the first application, after 2 days? That's what they taught us last week.
I do not.
Okay.
I do a week.
Okay.
I make sure my wound is granular, healthy, there's no infection, offload the wound, leave it on for a week. If I had the practicality of taking it off in 2 days, that'd be great. If insurance paid for a cast change every 2 days,
Okay.
that'd be fabulous, but neither of those things happen. So I leave them on for a week.
Do you want this one?
So, no, I'm going to stand. Let me get rid of this. All this stuff in my pocket that was falling all over the place. I had Advil in my pocket. Well, I better put it over so it doesn't fall out. I have a bad sore throat. A couple things. What I do is, with my ulcer, yours is on the bottom of your foot, in the middle of the foot. I clean it, debride it, stop the bleeding. Because if they bleed through their cast, they're calling you, even if you don't care. They care. Debride, stop the bleeding. Put on a nice dressing, a foam, an alginate, something that's not going to be disgusting. In a week when you take it, don't put Santal on. And put it under a cast and have it be debride, like, gets like mushy. Have a wound that you're ready to close, to put the contact cast. Or a wound that you're ready to get small enough to treat with Santal or something like that. And then do an offloading pad, right on the skin, stick on the skin so it doesn't slide, spray it with trainer athletic tape so that this sticks and the patient's foot doesn't sweat and it gets macerated and gross, and then when you go to peel it off, it takes all their skin off. So spray it with trainer tape. Skive the edges, make a nice offloading pad, make it hug the borders of the wound.
Can you do betadine, periwound too, just to help?
Absolutely.
Okay.
Absolutely. I do a lot of betadine, periwound, especially on wound backs. In a regular cast, battle cast, fracture cast, I just fold the stockinette at the anterior ankle. In a total contact cast, I cut it to make it a little bit, not completely, but just so it cut it and overlap a little bit to make it a little
Give
bit
a little
better.
more room.
This is a very compliant patient who knows how to dorsiflex their ankle.
Who can dorsiflex his ankle?
So remember, you may come to a time when you're doing this alone. Just remember that. So you have to kind of be as low maintenance as possible. So they tell you 1 layer of cast padding, which is great, except I put more than 1 layer anywhere a cast could dig into the skin. So around the toes and around the tibia. I go right off the edge of the toes because this is going to fold back with my stockinette. And then you have padding that comes over your cast so that your cast is bumpering into padding, not on someone's toes. So I'm going to go with 3 here. Now, notice this web rips. So there's no reason that if the leg is shaped like this, that you have large cylinders. Just rip it, turn it and rip it, and make it fit nice and snug. So, and be very particular. Less wrinkles, the better. Alright, Alex, enough of coughing. I can't get you back. 3 layers here, like 3 here, and then everywhere else, it's basically 1 layer, but I've overlapped it a little bit. So, they tell you to use 1 layer of padding, which I agree with. But you need to remember 2 things. Number 1, you're cutting off this cast at some point in time. And number 2, the weight of the cast and the swelling of the leg makes this do this. So when you have 1 layer on there, and they're walking, and this plaster is hitting the leg, you take off the cast and you look at the inside, there's no web roll in the spot where that happened. It stretches and it moves. So a little too much is better than completely not enough. Okay. So protect bony prominences. I cut these without like looking at you, so we'll see how. For very skinny, bony old people, I use thick padding. For big, heavy, sharko-y, blubbery kind of leg, use thin. Because it doesn't need as much padding. The bones aren't as prominent. You're in between. So, cover the malleoli. Sometimes they make this thing that looks like this with like a figure 8 on it that you lay on here, and then the sides come out over the malleoli. That's great if you can figure out how to make it. I'm not that crafty. But if you are, all the power to you.
Don't you rip that in half like that? Just rips in half like that?
Yeah.
It's pretty good.